Attention seniors, a Medicare mistake made by thousands of people every single year could cost you $2,400 in penalties forever. I'm talking about a permanent monthly penalty that never goes away for the rest of your life. Last month, a 71-year-old man named Robert from Cleveland, Ohio, got his first Medicare premium bill and nearly collapsed. The bill showed an extra $204 every single month, which adds up to $2,448 every single year, just in penalties. His hands shook as he called Medicare 3 times trying to understand what he did wrong. Before I show you how to avoid this nightmare, quick question, are you subscribed to this channel? Because last month, over 3,000 people told me they missed a video that could have saved them thousands of dollars. Don't let that be you. Hit the subscribe button right now because what I'm about to share is time sensitive. If you miss your enrollment window, you could be stuck paying these penalties for decades. Let me tell you about Helen. She is 68 years old and lives in Fort Myers, Florida. Helen worked as a nurse for 42 years and retired with a decent pension and savings. She thought she had everything figured out for retirement because she always paid her bills on time. When she turned 65 in March, she delayed signing up for Medicare Part B because she felt healthy. Fast forward 7 months to October. Helen went to her doctor for a routine checkup and tried to use her Medicare card. The receptionist came back confused and told her that her Medicare Part B wasn't active. Helen's stomach dropped because she had no idea what Part B even was. She called Medicare that afternoon and the representative told her she missed her initial enrollment period. The woman on the phone explained that Helen would now face a 10% penalty on her Part B premium for every 12-month period she was eligible but didn't sign up. Here's where it got worse for Helen. Medicare told her she couldn't even sign up until the general enrollment period from January 1st to March 31st. That meant she had to wait 3 more months without coverage, and her coverage wouldn't start until July 1st. By the time everything was calculated, Helen's penalty came out to $17.42 extra every single month for the rest of her life. She sat at her kitchen table that night doing the math, realizing this would cost her over $6,000 if she lived another 30 years. Helen burst into tears because she couldn't undo this mistake no matter what she did. Helen eventually enrolled during the general enrollment period and started her coverage in July. Her monthly Part B premium is now $192.37 instead of $174.95 because of that permanent 10% penalty. She paid the price for 7 months of delay, and she'll keep paying it until the day she dies. When I spoke with Helen last week, she told me she wishes someone had explained this to her before she turned 65. She said the penalty feels like punishment for not understanding a complicated system. This story matters because Helen isn't alone. Over 750,000 people turn 65 every single month in America, and thousands of them make this exact same mistake. Most people think Medicare automatically starts when you turn 65, but that's absolutely wrong. You have to take action during a very specific window, or you'll face these lifetime penalties. Helen's $17 monthly penalty might not sound huge, but multiply that by 20 or 30 years, and you're talking about real money. Let me tell you about James. He is 73 years old and lives in Phoenix, Arizona. James retired from the post office at age 64 and spent his first year of retirement traveling with his wife. He thought he could delay Medicare because he bought private insurance through the healthcare marketplace instead. Nobody told him that private insurance doesn't count as creditable coverage after age 65. One day in November, James received a letter from Medicare that made his blood run cold. The letter informed him that he owed a late enrollment penalty for both Part B and Part D prescription drug coverage. His hands trembled as he read the numbers. The Part B penalty was $52.48 per month because he delayed for 3 full years. The Part D penalty was calculated at 31% of the base premium, adding another $14.88 per month. Together, these penalties totaled $67.36 every single month, or $808.32 every single year for the rest of his life. But it got even worse for James. Because he missed his initial enrollment period, he had to wait for the general enrollment period to even sign up. That meant another 4 months without any Medicare coverage at all. During that waiting period, James developed chest pain and had to go to the emergency room. The hospital bill came to $18,247, and his marketplace insurance refused to cover most of it because of a technicality. James now faced penalty payments forever, plus a massive medical bill he couldn't afford. He couldn't sleep for a week straight, lying awake doing math in his head. James eventually got on a payment plan for the hospital bill, but he's still making payments 2 years later. His Medicare premiums with penalties now cost him $874.32 every single month when you include Part B, Part D, and his Medigap supplement. He told me last month that this one mistake has cost him over $30,000 so far between penalties and that hospital bill. What makes him angry is that nobody warned him this could happen. He wishes he could go back in time and enroll the moment he turns 65. Here's what makes me angry about these situations. Medicare sends you information, but it's buried in confusing pamphlets and government language that nobody understands. The initial enrollment period is 7 months long, starting 3 months before your 65th birthday month, including your birthday month, and ending 3 months after. If you miss that window, you're stuck waiting for general enrollment from January through March every year. But your coverage doesn't start right away. It starts July 1st, meaning you could wait over a year for coverage in some cases. Quick question before we continue. What state are you in? I need you to comment your state name right now. The rules I'm covering change by state, and I read every single comment. Plus, your comment helps other people in your state find this video. Drop your state in the comments right now. Now listen carefully to this part. There are some exceptions to the late enrollment penalty, but you have to know about them in advance. If you're still working at age 65 and you have health insurance through an employer with 20 or more employees, you can delay Medicare Part B without penalty. That's called creditable coverage. But the moment you retire or lose that employer coverage, you have exactly 8 months to sign up for Part B or the penalties kick in. Let me tell you about Dorothy. She is 69 years old and lives in Dallas, Texas. Dorothy worked for a small accounting firm with only 12 employees until she was 67 years old. She kept working because she loved her job and she had health insurance through her employer. What Dorothy didn't know was that employer coverage only counts as creditable coverage if the company has 20 or more employees. Her company had 12, so she should have enrolled in Medicare at 65. Dorothy retired in June and immediately applied for Medicare thinking everything would be fine. That's when she got the devastating news from a Medicare counselor. Because her employer had fewer than 20 employees, she should have enrolled in Part B when she turned 65 2 years earlier. Now she faced a 20% permanent penalty on her Part B premium. Her penalty came out to $34.99 per month, which equals $419.88 every single year for the rest of her life. She sat frozen in the counselor's office, unable to speak for several minutes. Wait, there's something else you need to know about Dorothy's situation. Medicare also told her she had to wait until the next general enrollment period to sign up. That meant waiting 7 more months without Medicare coverage. During that time, Dorothy needed a medication that cost $847 per month without insurance. She had to choose between paying for her medicine or paying her mortgage. She called her daughter crying, asking to borrow money for the first time in her adult life. Dorothy ended up rationing her medication, taking it every other day instead of daily like prescribed. Dorothy finally got her Medicare coverage started the following July. By that point, she had spent over $4,000 on medications out of pocket and racked up penalties that will cost her over $12,000 if she lives another 30 years. Her health suffered during those 7 months because she couldn't afford her full medication doses. When I spoke with Dorothy, she told me she had nightmares about that time. She said the stress of waiting for coverage while sick was worse than the money itself. This is where it gets serious. The Part D prescription drug penalty works differently, but it's just as permanent. If you go 63 days or longer without creditable prescription drug coverage after you're first eligible for Medicare, you get hit with a Part D late enrollment penalty. That penalty is calculated as 1% of the national base beneficiary premium multiplied by the number of full months you were late. The national base premium for 2024 is $34.70, so every year you delay adds another 12% penalty. Let me tell you about Patricia. She is 72 years old and lives in Portland, Oregon. Patricia retired at 65 and signed up for Medicare, Part A and Part B, right on time. But she didn't sign up for Part D prescription drug coverage because she rarely took any medications. She thought she'd save money by skipping Part D since she was healthy. For 4 years, Patricia didn't need any prescriptions and felt smart for avoiding those monthly premiums. Then everything changed in November when Patricia was diagnosed with type 2 diabetes. Her doctor prescribed 3 different medications that would cost over $600 per month without insurance. Patricia immediately tried to sign up for a Part D plan, but she discovered her 4-year delay would cost her dearly. The Medicare representative calculated her late enrollment penalty at 48% of the base premium. That added $16.66 to her monthly premium forever, costing her $199.92 every single year for life. Patricia's voice cracked when she called to tell her son about the penalty. But here's the catch with Patricia's situation. Because she tried to enroll outside the annual enrollment period, she had to wait until October 15th to sign up. Her coverage wouldn't start until January 1st of the following year. That meant Patricia faced 3 more months of paying $600 per month for her diabetes medications out of pocket. Those 3 months cost her $1,800 in medication expenses she couldn't afford on her fixed income. She ended up putting it on a credit card and paying interest on top of the drug costs. Patricia is now enrolled in a Part D plan, but she pays $81.66 per month when she should only pay $65 if she had enrolled on time. She calculated that this mistake will cost her approximately $6,000 over the next 30 years in penalties alone. That doesn't count the $1,800 she already spent during the waiting period. Patricia told me she wishes she had signed up for Part D at 65, even though she didn't need it then. The small premiums she would have paid are nothing compared to the lifetime penalty she now faces. Here's what they don't tell you about these penalties. They increase every single year because Medicare premiums go up with inflation. The standard Part B premium in 2024 is $174.95, but it was $164.90 in 2023 and $170.10 in 2022. Every time the base premium increases, your penalty increases by that same percentage. So if you have a 10% penalty and the base premium goes up $10, your penalty goes up by another $1 per month. Over decades, this compounds into massive amounts of money. If this information is helping you right now, I need you to do something. Hit the like button on this video. Here's why that matters. The more likes this gets, the more YouTube shows it to other people who need this information. It takes literally 2 seconds. Do it right now while you're thinking about it. Let me explain why this matters so much right now. If you're turning 65 in the next few months, you're in your initial enrollment period, and you need to act immediately. If you're already over 65 and you didn't sign up for Medicare, you need to figure out if you qualify for any exceptions. The annual enrollment period runs from October 15th to December 7th every year, and that's when you can make changes to your Medicare coverage. But if you've never enrolled, you have to wait for general enrollment from January 1st to March 31st. Let me tell you about Michael. He is 70 years old and lives in Atlanta, Georgia. Michael is a veteran who gets his health care through the VA system. He assumed that VA coverage counted as creditable coverage, and he didn't need Medicare at all. For 5 years, Michael never signed up for any part of Medicare because he thought veterans were exempt. Nobody at the VA told him any different, and he never received clear information about his requirements. Last spring, Michael had a heart attack while visiting his daughter in California. The nearest hospital wasn't a VA facility, so they treated him at a regular emergency room. The bill came to $87,456 for the emergency surgery and 3-day hospital stay. Michael submitted the bill to the VA, but they denied most of it because he received care outside their system without prior authorization. His heart sank when he saw the denial letter. He immediately called Medicare to sign up, but they gave him terrible news. Because Michael waited 5 full years past age 65, his Part B penalty was calculated at 50% of the base premium. That's an extra $87.48 per month, or $149.76 every single year for the rest of his life. On top of that, he couldn't even get coverage until the next general enrollment period, which was 9 months away. Medicare told him his coverage would start July 1st, almost a full year after his heart attack. Michael sat in his car after that phone call and couldn't drive home for 30 minutes. He felt completely trapped. Michael ended up negotiating with the hospital and got the bill reduced to $52,000. He set up a 5-year payment plan at $860 per month, plus his new Medicare premiums with penalties. Between the payment plan and the lifetime penalties, this mistake will cost Michael over $80,000 total. He's now 70 years old and will be making hospital payments until he's 75. When I spoke with Michael 2 weeks ago, he told me he's angry at himself, but also angry at the system. He said VA doctors should have told him he still needed Medicare, but nobody ever mentioned it. Now here's the good news. If you're reading this and you haven't made these mistakes yet, you can avoid all of this. If you're approaching 65, you need to understand your initial enrollment period and take action during that 7-month window. If you're still working with employer coverage, you need to verify that it's creditable coverage and understand your special enrollment period. If you're a veteran, you need to know that VA benefits don't count as creditable coverage for Medicare purposes. Pay attention to this next part. There are also situations where you might qualify to have your penalties removed or reduced. If you can prove you didn't receive proper notice from Medicare, or if you can prove you received incorrect information from a government employee, you might be able to appeal. The process is complicated and there's no guarantee, but some people have successfully gotten their penalties waived. You'd need to file a reconsideration request with documentation proving you were misled or never properly informed. Think about someone you know who needs to hear this. Your mom, your dad, your neighbor, your friend from church, someone who could lose money if they don't know what I just explained. Share this video with them right now. Copy the link, text it to them, email it, however you communicate. Do it now before you forget. This information is too important to keep to yourself. Let me tell you one more story about Barbara. She is 67 years old and lives in Denver, Colorado. Barbara turned 65 during the pandemic in 2020, and everything felt chaotic and confusing. She missed information about Medicare enrollment because she was focused on staying safe and healthy. Barbara thought she had automatically been enrolled in Medicare because she was getting Social Security benefits. She assumed the government would handle everything for her without any action required on her part. 2 years later, Barbara needed surgery for a knee replacement. When she went to schedule the surgery, the hospital told her she only had Medicare Part A, but no Part B. Barbara didn't even understand what the difference was. She called Medicare in a panic and learned she should have signed up for Part B when she turned 65. Now she faced a 20% late enrollment penalty of $34.99 per month forever. She also had to wait for general enrollment, and her coverage wouldn't start for 5 more months. Barbara's knee surgery had to be postponed for 5 months while she waited for Part B coverage to begin. During that time, her knee got worse and she needed a walker to move around her house. The delay made her surgery more complicated and her recovery longer. By the time she finally had the surgery, her penalty was locked in permanently. Barbara now pays an extra $419.88 every single year because of confusion during the pandemic. She told me she feels like she was punished for not understanding a system that nobody explained clearly. Here's exactly what you need to do right now. I'm going to give you 5 steps. Each one is simple and specific. You don't have to do everything today, but you need to start with step 1 this week. Write these down or save this video. Ready? Let's go through them. Step 1. Figure out your initial enrollment period if you're turning 65 soon. This is the 7-month window starting 3 months before your birthday month, including your birthday month, and ending 3 months after. Pull out a calendar right now and mark these dates clearly. If your birthday is in June, your initial enrollment period runs from March 1st through September 30th. Sign up during this window to avoid any penalties whatsoever. Do not wait until the last month because processing takes time. Do this today. Step 2. Check if you have creditable coverage that allows you to delay enrollment without penalties. Call your employer's Human Resources Department if you're still working past 65. Ask them 3 specific questions. Does our company have 20 or more employees? Is our health insurance considered creditable coverage for Medicare purposes? Can you give me that confirmation in writing? If your employer has fewer than 20 employees, you must enroll in Medicare Part B at 65, even if you keep working. Get this information within the next 48 hours. Step 3. Enroll in both Part B and Part D, even if you think you don't need them. The penalty for not having coverage is far worse than the monthly premiums you'd pay. Part D prescription drug coverage costs around $30 to $80 per month, depending on your plan. That's a small price compared to lifetime penalties. You can enroll online at medicare.gov or call 1-800-MEDICARE. The phone number is 1-800-633-4227. Do this during your enrollment period. Don't put it off. Step 4. If you already missed your enrollment period, sign up during general enrollment immediately. General enrollment runs January 1st through March 31st every single year. Yes, you'll face penalties, but every month you delay adds more penalties on top. Your coverage will start July 1st, so sign up in January to minimize the waiting period. Calculate your expected penalties by visiting the Medicare website or calling them directly. Accept the penalties and move forward, rather than delaying even longer. Sign up this January if you've been putting it off. Step 5. Talk to a state health insurance assistance program counselor for free help. Every state has SHIP counselors who provide free, unbiased Medicare counseling. You can find your local SHIP office by searching SHIP plus your state name online, or call 1-800-MEDICARE and ask for your local SHIP office. These counselors can review your specific situation, explain your options, and help you avoid costly mistakes. They can also help you appeal penalties if you have legitimate grounds. Schedule an appointment this week if you're confused about anything related to Medicare enrollment. Let me recap what we just covered. Medicare late enrollment penalties are permanent lifetime penalties that never go away once they're applied. You can be charged penalties for both Part B medical insurance and Part D prescription drug coverage. The penalties are calculated based on how long you delayed enrollment, and they increase every year when Medicare premiums increase. Over 20 or 30 years, these penalties can cost you anywhere from $5,000 to $30,000 or more depending on how long you delayed. You now have information that could save you thousands of dollars and decades of penalty payments. Don't waste it. Remember Robert from the beginning? After he discovered his penalty, he immediately called his cousin who was turning 65 the next month. His cousin enrolled during her initial enrollment period and avoided any penalties whatsoever. She called Robert last month to thank him because she almost made the same mistake. You can do the exact same thing. The only difference between people who pay penalties and people who don't is that informed people act during their enrollment window. If this video helped you, here's what I need you to do. First, subscribe to this channel so you don't miss the next urgent update. Second, share this with someone you care about, someone who needs this information. Third, leave a comment telling me your state or your situation. I read every comment and I try to respond to as many as possible. Your comment also helps other people find this video. Take 30 seconds right now to do these 3 things before you click away. One more thing. This video is for educational and informational purposes only. It is not legal advice, financial advice, tax advice, or medical advice. I'm sharing general information, but every situation is different and laws vary by state. Before you make any decisions based on what you heard here, please consult with licensed professionals like attorneys, CPAs, financial advisors, or insurance specialists who can look at your specific situation. What works for one person may not work for another. Always verify information with Medicare directly before making enrollment decisions.